Mr. Majewski's Anatomy 32 class lecture, Chapter 9, Part 2, Specific Joints. So now we're going to talk about some specific joints found in the body, and you'll be required to remember the names of these joints and the general features of these joints that I go over. However, the only one where you'll need to know the name of absolutely everything will be the knee joint. So let's start with the jaw joint, or as we like to think of it, the temporomandibular joint, which turns out is a combined hinge and plane joint. So some of the components of the temporomandibular joint. Well, you have the condylar process of the mandible. That is the part of the bone that's attached to the mandible. And then the mandibular fossa of the temporal bone. And these two bones articulate to form this temporomandibular joint. There's also a meniscus found inside of the articular capsule of the temporomandibular joint, and of course the articular capsule itself, which you'll find in every one of the joints we're going to talk about because they're all synovial joints. There are also a number of ligaments that are important for attaching the mandible to the temporal bone, and this allows us to do a number of things, including opening and closing our mouth, or as they like to call it, elevation of the jaw and depression of the jaw. You also can protract and retract your jaw, and also move your jaw from side to side. Next is the shoulder joint, which is a ball and socket joint. The bones involved include the head of the humerus and the glenoid cavity of the scapula, and of course the articular capsule, because this again is a synovial joint. Other things you find the glenoid labrum, which again acts as sort of an additional extension of the joint to make it a little bigger and to provide a stronger connection. And there are also some bursae and a tendon sheath found in the shoulder joint. And of course ligaments, lots of ligaments. And this allows you to move your arm in a number of ways, including flexion, extension, and hyperextension, circumduction, lateral and medial rotation, and abduction and adduction. Next is the elbow joint, which is a hinge joint. The bones involved include the trochlea of the humerus that articulates with the trochlear notch of the ulna, and the capitulum of the humerus, which articulates with the head of the radius. You'll also find an articular capsule, some ligaments, and a bursa right there at the very end of the elbow. And this allows for the extension and flexion of your arm. Then there's the hip joint. This is a ball and socket joint. Its components include the head of the femur, which is a very large head, and the acetabulum of the os coxa, the hip bone. Again, there is an articular capsule because this is a synovial joint. There are various ligaments involved, and the acetabular labrum, which again acts as an extension of the joint so that it is somewhat stronger of a connection. This allows for various movements, including the flexion, extension, and hyperextension of the entire leg, abduction and adduction of the leg, circumduction of the leg, and medial and lateral rotation of the leg. And there's the ankle joint. This is a hinge joint. It includes the medial malleolus of the tibia, the lateral malleolus of the fibula, the articulating surface of the talus, so those three bones interacting together right around here, as well as, of course, the articular capsule and quite a few ligaments. And this allows you to dorsiflex your foot by moving it up, or plantar flex your foot by moving it down. And then there's the knee joint, which is a modified hinge joint. And the knee joint, it turns out, is the largest and most complex of the various joints of our body. And here you're going to know all the finer details of the knee joint. So to start with, we have the femur, and it is articulating by its medial and lateral condyles, and by its patellar surface. And at the patellar surface, it will be articulating with the patella's articulating surface. And with its condyles, it will actually be articulating with the tibial lateral and medial condyles. There are 3 bursas found in the knee joint. There's the suprapatellar bursa, supra above the patella. There's the prepatellar bursa, it's in front of the patella. And then the infrapatellar bursa, infra, below the patella. And here, these bursas are key to reducing some of the friction found at these points of the knee. There are also 2 menisci within the knee joint and within its articular capsule. That includes the lateral meniscus, always found on the same side as the fibula, and the medial meniscus. And these not only help to reduce friction and absorb shocks when you step down really hard, but it also helps guide the condyles as they articulate with each other. Of course, you have the articular capsule. This is going to include the articular cartilage or hyaline cartilage found at the articulating surfaces of these bones, as well as the fibrous tissue that then forms the complete articular capsule. And of course, inside that capsule will be the articular fluid. Also involved is the quadriceps tendon. This is going from the quadricep muscles down to the patella bone. So again, tendons attach muscles to bones. And then this continues on as the patellar ligament, going from the patella to the tibia. Now again, within the articular capsule, not only do we have the menisci, but we also have 2 ligaments, the posterior cruciate ligament, or PCL, and the anterior cruciate ligament, or ACL, that again help to keep the 2 bones together during the movements of the knee. Outside of the articular capsule is the fibular collateral ligament on the side of the fibula, and the tibial collateral ligament on the side of the tibia. And then also running along the length of the knee is the lateral patellar retinaculum and the medial patellar retinaculum. And basically the purpose of the retinaculum is that it provides a space to allow muscles and tendons to pass through and around the joint without having to experience the friction caused when that joint is in motion. And with all that complexity, what does the knee do? Well, it extends and it flexes. That's it. However, of course, the knee is very important, and when it doesn't function right, you get kind of unhappy. So, for instance, you often hear of athletes experiencing a torn ACL. And what this basically means is they got hit by something on the lateral or outside of their leg near the knee joint, and this has caused a tear in the anterior cruciate ligament. It could be a complete tear, it could just be a partial tear. And also, often with these kind of injuries, you get damage to the medial meniscus and the tibial collateral ligament. And since tendons and ligaments and cartilage in general tends to take a while to heal, often a person has to undergo surgery to get them repaired to try to speed the process up a bit. Another issue could be the need for someone to have their knee joint replaced because they've worn it down so much over time that to continue to have a functioning knee and also to not experience pain, they need to have some artificial components put in to replace the worn down portions of the knee. And the way this works is actually pretty extensive. They have to remove the articulating surface and of the femoral bone. They have to remove the top of the tibia and part of the patellar surface. All that has to be removed and then replaced with these metal components. However, in the process, they try to retain as much of the patellar ligament and the quadricep tendon as possible because it's really hard to replace those components. There are also some other joint disorders that exist. You can get a sprain, which is simply a overstretched or perhaps torn ligament that usually heals on its own if allowed to. You can have a dislocation where the bones are forced out of alignment and are no longer properly fit in the joint, and these then have to be reduced, which means returned to the original location. You can have torn cartilage. This is often when it's subjected to high compression or tension, and cartilage, again, like I said, tends not to heal itself, or at least it's so slowly that you really want to speed it up a bit with some arthroscopic surgery. You can also get inflammation in your bursa or in your tendon sheets. This would be bursitis or tendinitis. And then, of course, there's arthritis, which is an inflammation and or degeneration of the joints. And this can be caused by a number of different things. It can be osteoarthritis, which basically means the joint's been wearing down over time. It can be rheumatoid arthritis, which is actually an autoimmune disease. So your immune system is actually attacking your joints, making them less functional. You can have gouty arthritis. This occurs when uric acid is accumulating in certain joints, often in the big toe, for instance, and can cause a lot of pain when the person tries to walk. And it has been shown that arthritis can also be caused by Lyme disease, although this is not fully understood. And that's it for this part of the lecture.